Just going to gently roll around the eyes. So you're going to add a reasonable amount of pressure, and you're just going to take that roller and you're going to roll around the eyes for about 3 minutes. 3 minutes in the add-on eye treatment and 6 minutes in the standalone. And there's no specific pattern, but you just want to make sure that it's very fluid and very controlled, and that you're rolling in the areas. If somebody, you know, is really concerned with puffiness under the eyes, then you want to roll outwards and kind of down, outwards and down. If somebody is concerned with crow's feet, then we want to spend time in that area, smoothing and releasing and stimulating that area right there. But overall, you want to spend 3 minutes just really nicely, gently going around the eyes of the client. And it feels nice, it feels cool. And the energy from the jade stone is really helpful in getting the client to kind of connect to their body, which is really what balance is all about when it comes to Ayurveda, when it comes to traditional Chinese medicine. What we want with our clients and with our holistic approach to skin health is getting our clients to make that mind-body connection with regards to skin, because we know that it's impossible to help heal somebody.
Your hair distribution is equal bilaterally. The temperature is warm and equal bilaterally. Muscle tone, equal bilaterally. The turgor is present in both arms. There's no lesions present, and there's a normal color. And now I'm going to ask that you grip my hands and squeeze. And you do have a strong grip bilaterally, so that's good. And I'm going to assess your fingernails. And you do have, they are a normal size and shape and color. The nail beds are at about a 160-degree angle. And I'm going to check your capillary refill, which is less than 2 seconds. On the other side. These are also a normal size, shape, and color. The angle is also about 160 degrees. And check the capillary refill. And it's less than 2 seconds bilaterally. And now I'm going to do your chest. Ask that you take a deep breath. Another one. And another one. The chest is equal bilaterally. Now I'm going to assess your turgor, which is present bilaterally. And then I'm going to assess your toes, which your toes are normal size, shape, and color. Capillary refill less than 2 seconds. Also normal size, shape, and color. Capillary refill less than 2 seconds bilaterally. And now I'm going to ask that you do the Homan's test by putting your leg up and flex your foot as far as you can. And do you feel any pain in your calf when you do that? No? Okay, so that's good. And now I'm going to check your peripheral sensation on the side. Do you feel this?
Yeah.
Yeah? Okay. Put your leg up. Flex your foot down. Do you feel any pain on this side? No? And can you feel this? Yes. Okay, so I did the Homan's test and checked for peripheral sensation.
Nose, your eyes, your mouth, and everything seems to be okay. Next thing I'll do is I'll go ahead and palpate. Any pain or tenderness when I palpate your skull?
No.
I don't feel any deformities, anything out of the ordinary. Her hair seems to be in good condition, it's well distributed. Next, we'll go ahead and move on to your sinuses here. I'm just going to palpate your frontal sinuses, okay? Mm-hmm. Any pressure, any tenderness when I do this?
No.
Okay. And what about the maxillary?
No.
Okay. So no tenderness in any of her sinuses. And then we'll just palpate her carotid artery. Make sure that it's palpable. It has equal amplitude on each side. And each is palpable and equal. I'll do pre-auricular here in front of the ear. Post-auricular. Occipital. Tonsillar. Submandibular. And submental. Next, we'll do your superficial cervical chain, your posterior cervical chain, and then your deep cervical chain, and then go down to the supraclavicular. Any tenderness when I do any of that? Alrighty. So next we'll go on and look.
Using the eyes, you just tell me if you feel one or two problems. One. Two. Two. One. 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 Two. One, two, one, two. Okay, perfect. We'll stop there. What you actually got to sense, yeah. A little, yeah. But, so.
Examine the hand while the patient is seated with the hand resting palm up on the exam table and the arm exposed to the elbow. Ask the patient to relax the hand so it assumes the position of function, or rest position. In the position of function, the fingers are flexed uniformly. Note they are not parallel. Instead, they all converge at a single point on the wrist. Note that this subject has a slight rotation of her little finger, which appears slightly tucked under the ring finger. With the fingers flexed 90 degrees, examine the fingers end on. The fingernails should all be parallel in the same plane. Inspect the palmar and dorsal aspect of the hand for gross deformity, redness, and swelling, particularly at the metacarpophalangeal and interphalangeal joints. And then resist attempts to squeeze them together. Then test range of motion and strength of each digit, starting with the thumb individually and its ability to pinch each of the fingers. Then test the posterior interosseous nerve by having the patient lift the index finger against resistance, and then the thumb. Then systematically assess flexion in the other fingers by holding the proximal interphalangeal joint in place and having the patient flex the fingertip. This isolates the profundus tendon. Then have the patient flex at the PIP joint. Check for trigger finger by having the patient flex each finger while you palpate over the flexor tendon at the distal palmar crease, where you may be able to feel a nodule catch in the A1 pulley.
Slightly at first. Just looking for any scaling or like changes in skin, any abnormalities and bruising. And then I'm just gonna lightly press. You let me know if there's any pain anywhere around here. Nope. That all feels okay? Yep. Size okay? That feels the same? Yep. Okay. Good. Good. Yep. Okay. Perfect. just have one more test for that. So I'm gonna stick this in your mouth once on each side. I'm gonna have you bite down on it, and then when you're gonna raise this, and I'm gonna try to pull it out. Okay? So let's start on this side. That's good. And on this side. That is good.
Hurts at all. So I'm feeling that it should be squishy and movable, and it shouldn't be very painful at all. While I'm feeling it, can you swallow again? Okay. While I'm here, I can feel the thyroid cartilage, and can you swallow for me one more time? Making sure that all is good. And then now I'm going to move up to the lymph nodes. So I'm going to start at submandibular, feeling with like a circular massaging motion, and move my way back to the anterior auricular lymph nodes, and then down in front of the SCM. I'm going to feel for any hard, non-movable masses. And is any of this tender at all?
Mm-mm.
No. And then check the lymph nodes in the clavicle for sure, because that's where a lot of the drainage is. And then work my way up the back of the SCMs. So I'd have you look towards me, don't push into my hand. And that feels good. And then on this other side too, push into this hand. Okay. And then also looking at the
cricoid cartilage. Then go 3 centimeters below to the thyroid isthmus. Have the patient take a sip of water and swallow. Note the rise and fall of your index finger. Next, have the patient take a sip of water and hold it in their mouth till you tell them to swallow. Place 2 fingers of both hands bilaterally alongside the trachea. Have the patient side bend and flex towards the left side to assess the left lobe of the thyroid gland. Using your right 2 fingers, press against the trachea to dislodge the thyroid gland. Palpating with your left hand, have the patient swallow. Note any asymmetry, tenderness, enlargement, or nodules of the thyroid gland during that swallow. Repeat for the opposite lobe.
Okay, and then go ahead and look behind me, and then look at my pen line. Okay, next I'm going to measure the pupils. They're about a 4, and then go ahead and just stay still and look forward. Okay, the pupils are equal, round, react. Can you stick out your tongue for me? Okay, can you say ah? Ah. Okay, can you, the uvula raises midline, the tongue sticks out straight, I'm going to perform the gag test, the gag reflex test, and lymph nodes. So I have the preauricular, the postauricular, the occipital, the tonsillar, the submandibular, submental, postcervicular, supracervicular or superior cervicular, the supraclavicular, and the deep cervical. And I'm going to do the posterior auricular.
Alright, color's pink. The surface is rounded. The edges looks like you bite them. Have refill is less than 3 seconds. Cervical.
Okay. Put your head back a little bit. Okay. You check your teeth. Any loose ones? Mm-mm. Looks like you got good teeth. Go to the dentist often? About yearly? Okay.
I'm just going to have you tilt your head back a little bit for me. I'm just going to palpate this when you swallow. good, good movement. So also while we're doing this, we're just going to look for any nodes that may be present on the sides, and I don't feel anything. So there's no nodules. That's very good. When you come over here, we're going to look at her temporal mandibular joint. So for the purpose of this, we're just going to do one side, but I'm going to have you open your mouth for me. Good. I'm going to have you close it. Can you open it again and wiggle side to side? Good. There's no clicking noises. All right. So next, I'm going to take a look at your lymph nodes. So there's two right here, the pre and the post auricular. Just going to try to palpate anything so I don't feel anything. So working my way down to the tonsillar. Again, I don't feel anything. Submandibular along her jawline. And submentals directly under her chin. Cervicular on the side of her neck. So for the supraclavicular, I'm going to have you turn and tilt your head. Can you try to touch your chin for me?
Okay, the preauricular, postauricular, submaxillary, supraclavicular. And check your skin turn while I'm here. And no signs of tenting, so you're nice and hydrated. And look at your trachea, nice and midline. Can I have you swallow for me? And feel no sign. All right. Negative Babinski. And negative Babinski, good. Let's palm down here. Florida. Go into the whole line. Herb's Point. Tricuspid. And mitral, which we're going to listen to for a minute.